What is the Bariclip? The Bariclip is a new, promising technology we can use to treat obesity. By laparoscopy with small holes, I will put a clamp, a vertical clamp, around the stomach. And this clamp will reproduce the effect of a gastric sleeve without removing any part of the stomach. It's clipping, not cutting. That means there is no risk at all of leakage, and it's a reversible procedure. We can remove if needed. If the patient doesn't want to keep it anymore, we can remove by laparoscopy. For that procedure, I need around 45 minutes with 4 small holes. And few hours after the surgery, the patient will be allowed to drink first, and then he will start so for the 2 first weeks a liquid diet before mashed food for 2 other weeks. In 1 month, he will lose 8 to 9% of his weight. Another big advantage of this technique is the absence of acid reflux. Acid reflux is the weakness of gastric sleeve. We don't see anymore acid reflux with Bariclip. One patient around 1% versus 20-30% with a gastric sleeve. Second advantage, if in the future we need to add something else, we can keep the clip and do a transit bipartition like a SADI, or we can remove the clip and we can proceed to sleeves, to gastric bypass, to mini bypass, to almost all procedure, because it's reversible. In terms of side effects, in terms of complications, the only one we saw at the beginning of this new technique, it was the risk of slippage of the clip. And now, by changing the technique, I have improved the recovery, and this rate of slippage dropped from 4-5% to around 1%. And when you have a slippage, it's during the first days. So we don't see almost any more slippage. It's a very effective technique, but because it's only a restrictive procedure, you need to change your lifestyle. And if you are changing your lifestyle, if you are avoiding fatty food, carbs, and you are doing more exercise, definitely you will be very happy with this technique and you will lose a lot of weight. But if you don't do that, you can regain weight like with all other procedures. Before doing a Bariclip, we need some assessment like an upper endoscopy to check inside the stomach, blood work to check the vitamins level, to see if you have diabetes or high cholesterol. We need to check the vitamin level, I said, and you need to be clear by a psychologist and to see a dietitian. And after that, we can proceed. And it will be the beginning of a new start.